wait one more minute.
No problem.
Good afternoon.
Does it make noise?
All right. So, hi, everybody. I'm Laura Redwine, and I am the University of Miami Clinical Research Director of the Osher Center for Integrative Health, welcoming you to the Wolfson Foundation Speaker Series. So, I'd like to introduce you to Dr. Mark Nestor. We're very grateful for his uh, willingness and to present today. Dr. Nestor received his MD and PhD in immunopathology from UCLA School of Medicine and completed his dermatology residency at NYU. He's a fellow of the American Academy of Dermatology. Dr. Nestor is a board certified dermatologist and serves as director of the Center for Clinical and Cosmetic Research, the CCCR, and the Center for Cosmetic Enhancements in Aventura, Florida. He's a voluntary professor in the Department of Dermatology and Cutaneous Surgery and the Department of Surgery, Division of Plastic Surgery at the University of Miami Miller School of Medicine. As the director of the Clinical and Cosmetic Research Center, he has conducted more than 150 FDA and non-FDA clinical trials. He has authored over 150 articles and book chapters and has delivered over 1,200 major presentations around the world. So without further ado, I am thrilled to introduce you to Dr. Mark Nestor.
Thank you, Laura. Appreciate it very much. It's absolutely my pleasure being here today. I am very much in tune and in agreement with integrative medicine. It's one of my passions. I think that we need to expand our armamentarium against disease, and I think doing things in a lot of ways in a natural way, as I'll talk about, has tremendous merit. And I'm going to talk about medical foods, which is a unique category, and we're going to talk about innovations in clinical aesthetic and regenerative medicine. I'm going to have obviously a little bit of a tilt towards dermatology because that's my specialty, but I'm going to talk about this to be able to talk in general about the benefits. And I think everybody who listens to this can think about how this applies also to the specialties and areas that they're most interested in. I work with a lot of companies specifically for this. We're talking about Primus Pharmaceuticals. I'm going to talk about this briefly at the end because it's important because medical foods is a unique category and it's not just the ingredients. It's actually, as I'll talk about, the pharmaceutical rigor. And this is really the only company that has and distributes an RX, a version of these medical foods. And I'll talk about that at the end. So why are we talking about this? Well, for integrative medicine, we know that consumers are really shifting. They have a desire to use food as a means of managing their health. And a Deloitte survey showed that 76% of Americans would prefer to use food over prescription medications for their health and well-being. And this was regardless of income, insurance, health status, etc. And some patients are actually looking to treat chronic illnesses from food prescriptions, meal planning, etc., as part of their care. And medicine has really embraced this. The American Heart Association this past year issued a statement calling for more use of food for medicine and more research in this area, certainly. And physicians and healthcare providers are looking for natural, innovative ways to treat disease and promote the patient's well-being, health, and of course, appearance. As a dermatologist, this comes front and center very often. And there are three key factors overall for this. We want to look at efficacy, safety, And the third thing is I'll call availability or affordability for patients. If something is incredibly expensive, it's not going to help them if they can't afford it. And I think the FDA category of medical foods presents us with a unique opportunity to treat disease as well as enhance aspects such as beauty, health, and well-being. Now, what is a medical food? A medical food is a product with ingredient or ingredients under FDA regulatory category that was originally designed for nutrients to be given to a patient under the physician supervision. That's important. It falls under the Orphan Drug Act, and the product is intended to treat a condition or a disease and has specific safety standards under GRAS, are generally recognized as safe. And in certain ways, you can think of this as an RX pharmaceutical grade super supplement. But pharmaceutical grade is the key issue. You have to write a prescription for these. And of course, because it's pharmaceutical grade, there's some benefits. And these are the different categories here, the regulatory categories. And the important thing is the distinction between dietary supplements and medical foods. It's for disease states. There is a safety standard under GRAS, scientific requirements for affirmation. It needs supervision, a prescription, and it's under the Orphan Drug Act. And the idea here is that this is pharmaceutical quality system. The active ingredients are single source, pharmaceutical grade, high purity, high bioavailability, and consistency. This is medication, so it's consistent of lot to lot, and that's totally different than supplements. Pharmacovigilance is in place. Manufacturing facilities are FDA inspected, and essentially this falls under GMP guidelines for all the aspects. And this just shows the quality system that's inspected by the FDA for materials, production, laboratory, etc. So this is more like a drug, certainly, than it is anything else. So I'm going to talk about three different medical foods or ingredients in medical foods, I should say. And we'll talk about the overall effects, benefits across the board. And the first is diosmin. Diosmin is a flavonoid, and diosmin usually comes from orange peel in this case. And the indications for this are stasis dermatitis, but there's tremendous additional, as we'll talk about, health benefits, especially towards the research that's being done with diabetes. So I'll start out with a case study. We see this in dermatology, and I'm sure many of you see this in your patients overall. 78-year-old female, bad circulation for years, a breakdown in the skin. Patients try to use compression, but they're not compliant. And despite topical steroids, nothing helps. What to do? And then the second one is this unfortunate patient with a 10-year history of changes with recurrent ulcers on the lower legs. Again, not compliant, multiple courses of antibiotics, and what to do. So stasis dermatitis is really a key aspect of the skin from chronic venous disease. Chronic venous disease is obviously something very, very common. It's been in the news lately because of the president having this as well and talking about management. Venous leg ulcers are also very common. They're frustrating. And management options historically have been essentially leg elevation, compression, and some procedural interventions. Topical steroids can help in certain ways for the barrier. But in Europe, especially, diosmin is really a mainstay of treatment, and hopefully it's being done more and more here as well. This is just the classification method that is used for this. And what we see in dermatology is generally the keep classification of 4, 5, and 6 with changes in the skin. But the edema and varicose veins are certainly things that are commonly seen in earlier stages of this as well. So University of Miami is probably one of the biggest areas for wound care, especially for ulcerations in the country, under a number of individuals as well in the university. And for years they've been doing this. And this is a paper that came out probably 20 plus 25 years ago, talking about diosmin as a specific benefit to these patients with lower extremity ulcerations. A number of studies and have been done in this as well. And indeed, conservative therapy is the mainstay of treatment. And this certainly includes diosmin. MPFF is just a form of this that's more bioavailable. The key issue here is there's two aspects to this on lower extremities. There's a mechanical aspect and a secondary inflammatory aspect. These kind of go to get venous hypertension on the lower extremities and the stasis dermatitis change. And the idea here is that you have incompetent valves in the lower legs, which are both genetic and age related. Because of that, you have reduced capillary flow, you have white blood cells coming in, you have a number of mediators that I'll touch on, edema, skin pathology, and then eventually you can get venous ulcerations. And this whole thing is a loop here as well, which feeds on the overall inflammation and worsening of the condition. As I said, this involves a number of inflammatory mediators that are really looked at very extensively these days in multiple disease processes, TNF, VEGF, all of these are active in causing inflammation, and the inflammation is really the key to causing a lot of the changes that occur in this condition. How do we treat this? This is the paper that I just discussed. I think the key issue is that diosmin is probably useful across the board in stages 1 through stage 6. And again, there are other procedures and other things, especially compression, that are used in this. But the benefit both to the blood vessels and to the inflammatory mediators are key to getting the benefit with diosmin. Diosmin itself is incredibly safe. There have been multiple trials that show much higher amounts of diosmin to be safe in humans without toxicity. And what's so interesting is that even though the indications are venous, and by the way, one of the other indications is hemorrhoid, which is a cousin to this, wound healing and stasis dermatitis, there's data on things such as lymphedema, diabetes, cancer, neuropathy. I'll touch on some of these because those two aspects, the vascular aspect and the anti-inflammatory aspect, are key to the benefits from diosmin. This is just showing the benefits in the lower extremity ulcerations. And again, the idea here is that all of these studies show that it has very favorable safety, no real AEs, and significant benefit in quality of life for the patients. What I see in my patients is the first thing that happens is pain and uncomfortableness of the lower extremities improves. That heralds even the improvement in the skin as well. Again, these are just specific wound healing for ulceration studies showing that indeed for venous leg ulcers, there is a significant effect, a beneficial effect and improvement. This is one study, another study here out of Europe, again, showing very, very similar degree of benefit in a randomized placebo-controlled trial. And then finally, another one here showed the significant benefit and the improvement in healthcare and reducing healthcare expenditures as well from the use of this. So again, really getting benefit to healing from that perspective. Here are just some photos showing differences in edema, the changes in stasis dermatitis, and indeed even the ulcerations as well. What's so interesting, and this I'm going to get at with all these medical foods, is that there are tremendous health benefits separate and apart from the specific indication. And again, with this, it's a chronic venous disease, etc. Because diosmin has very potent antioxidant, anti-inflammatory properties with all of these cytokines we're talking about, anti-cancer, um, anti-diabetic, I'm going to touch on this in a moment, antibacterial as well as others. I think that the key issue for all of these medical foods is that they have a vast benefit across the board for a variety of different conditions from there. Diabetes is probably one of the most studied conditions for the use of diosmin, and we know it involves inflammation, oxidative stress, endothelial dysfunction, and diosmin may help this by reducing that damage, including improving blood vessel function and modulating glucose metabolism. It increases antioxidant activities, anti-inflammatory effects, reduces TNF alpha, interleukin 6, and improves insulin sensitivity. And it may actually help regulate lipid metabolism as well. In animal studies, it shows a reduced fasting blood glucose, improved glucose tolerance, increased insulin secretion, and peripheral glucose uptake. There aren't a lot of blinded studies in humans at this point, but there is significant interest in this. The main reason there haven't been a lot of studies is that there haven't been a lot of patented drugs, and honestly, that's really where all the money goes for these studies from there. But it's clear that in many places of the world, this is one of the first treatments for diabetes. What's interesting is that the complications of diabetes are probably the most studied. I use this in a lot in my patients with neuropathy, and I've had great results. Reduces nerve damage markers, nephropathy, it protects kidney tissue, retinopathy, improves microcirculation. There's significant benefit to cardiovascular disease by vascular integrity. And in diabetic rats, as I said, all of these benefits, and it's even dose dependent in these studies. So, diabetes, as I said, is one of the interesting areas of study for this. Now, for the skin, we have conditions that really other things don't seem to work very well. And one of them is called Schamberg's disease or progressive pigmentary dermatitis. And bioflavonoids seem to work incredibly well. I have a number of patients on this with great results without anything else helping this. Rosacea, especially severe rosacea, is another area where we have very significant benefit. There are some topicals that utilize this, but I think the orals in patients like this who have severe rosacea, this is one patient and here's another, are really the most that benefits this. Bates purpura or senile purpura is ubiquitous in an older population. This is a study that showed a randomized placebo-controlled study and showed a dramatic reduction, a 50% reduction in purpuric lesions from baseline in 3 months. And I have many, many patients on this long term with very, very significant improvement at that point. In terms of cosmetic, this is hyperpigmentation. This just gives you one aspect of the benefits because of the inhibition of tyrosinase. And this is something both topically and orally that we tend to use for the benefit of hyperpigmentation. Now, the second medical food is it's the actual medical food is known as rheumate. It's a combination of L-methylfolate, curcumin, and B12. This was actually originally approved for patients taking methotrexate because of the L-methylfolate, but it's really the curcumin that is the key that we're going to be talking about here. And this is for a number of immune-mediated diseases. I'm going to talk about in cardiovascular diseases and others as well. But it's really fascinating from this. And this is a patient that I see very frequently with psoriasis, was put on methotrexate, which may be affecting the liver. And we use L-methylfolate to protect the liver in these patients. And there are a number of studies that show that folic acid is very, very beneficial to both GI side effects and hepatic dysfunction. But what's happened, what we've learned is this whole issue of MTHFR polymorphisms that occur in half the population have a significant detriment to folic acid. And this gets around, well, to get around this, you can take L-methylfolate. What's interesting here is that studies show that in the past that B12 was always added to the L-methylfolate because there was some concern about cognitive effects, and the B12 got around the cognitive effects. But a few studies since then have shown that that's probably not the case. And the good news is B12 is not going to hurt anyone, so that's a benefit. Now, this area, which to me it's fascinating, of MTHFR polymorphisms is something very, very topical at this point. Half the population has at least a heterozygous allele for this. Smaller have homozygous alleles. But the idea here is that you don't absorb and metabolize folic acid. But as you can see on the right side here, the MTHFR concentrations, if you're using L-methylfolate, does work very, very well. You are absorbing it. So this gets around this. And, this is something that people talk about now with everything from ADHD to inflammatory conditions, et cetera, both across the board for health indications, as this whole MTHFR polymorphism is being uncovered, because probably of the effect of either detrimental of folic acid or not being able to metabolize it from there. Now, curcumin itself is probably one of the most interesting natural molecules. It's derivative of turmeric, and in general, it's not very bioavailable without complexes. It's anti-inflammatory, anti-mutagenic, antioxidant, chemotherapeutic, chemopreventive. Its wide therapeutic safety index is very, very well tolerated in individuals with no or limited side effects at very, very high doses. And its efficacy, as we'll talk about, is across the board. Autoimmune diseases, cancer, cardiovascular, infectious, neurologic, tremendous different benefits to different diseases. And this is one of the hallmarks of Ayurvedic medicine as well. This is one of the main things that is used from there. There are two issues. It has a very, very high ORAC score, antioxidant score, but in general, it's not very well absorbed. And this on the right is shown the normal absorption. People talk about taking it naturally with some pepper products, but this is actually called biocumarex. And this has a very, very nice absorption rate. So in this medical food called rheumate, there's very high bioavailability from there. The pathways of this, as an immunologist and dermatologist, are incredibly interesting. It has an effect on a wide variety of pathways, signal pathways, and I'll touch on some of these because the major drugs that are being promoted now, biologics and JAK inhibitors for a lot of diseases, fit into this as well. The inflammatory pathways mediators, TNF, interleukin 12, interleukin 23, are inhibited by this, and downstream interleukin 22 and 17. This also decreases TNF alpha and others as well. And these are critical in psoriasis, atopic dermatitis, alopecia, in dermatologic conditions, but also, as you'll see, in rheumatoid arthritis, in inflammatory bowel disease, in many, and in cardiovascular disease as well. And just again to give you the idea here is that all of these are biologics that are the mainstay of all of the biopharma right now, and these inhibit the same pathways that we're talking about this, at least for psoriasis. The next pathway is NF-kappa B, and this is a very interesting pathway. It's a variety of skin diseases, including atopic dermatitis, but NF-kappa B is also in conditions such as lupus and other autoimmune conditions as well. The JAK pathways are really becoming very topical in psoriasis, vitiligo, atopic dermatitis, alopecia areata, but again, more and more in other mainstream medical pathways. And this is inhibited by this as well. And this, again, is just showing the drugs that are out there that inhibit these JAK selective pathways. MAPK is an interesting anti-tumor pathway this disrupts this pathway. I'm sorry, it's a tumor promoting pathway that it disrupts. The MAPK plays a critical role in a number of diseases. Melanoma is a very, very important one, leading to tumor progression. Finally, in terms of regenerative medicine, we talk about the mTOR, a signaling pathway, the rapamycin pathway. And this is something that there's very strong evidence that there is a very specific effect on this pathway from curcumin. And in the skin, it's especially the SERT pathways, which decrease with age. There's a significant promotion of this, showing the anti-aging effect on the skin and other things. So how does this work with disease? Well, rheumatoid arthritis, there's a number of studies that showed that curcumin, and again, the problem with some of these studies is they may not have the same bioavailability as we're talking about with biocurin, but it shows very significant improvements in all aspects of disease in terms of tenderness, swelling, overall disease activity in rheumatoid arthritis. In ulcerative colitis, this shows something very similar. And what's so interesting is you have remission aspects that are very dramatic statistically, not only clinical remission, but endoscopic remission. So again, this is something that is very well tolerated and looked at in ulcerative colitis. Psoriasis is one of our passions. And again, there are in vitro models, mouse models, and meta-analysis that show effectiveness in psoriasis. And where I use this most is in more limited psoriasis, where we use topical steroids primarily, and the combination tends to work extremely well as the psoriatic arthritis associated with a lot of psoriasis patients. Atopic dermatitis is also something that we see a lot of. Eczema, again, very effective in terms of recurrence rate as well as itch. This is a study that talks about these aspects about it. And then switching to cardiovascular disease, there are some tremendous benefits that are looked at here. And this includes improving endothelial function by enhancing nitric oxide availability, promote vasodilation, arterial flexibility. And then the lipid effects are reduces LDL, triglycerides, and it may increase HDL as well. The specific effects on plaques, it inhibits plaque formation, reduces oxidation of LDL, and it may even stabilize existing plaques. So all of this has very significant benefits in cardiovascular disease. I'll touch on beauty. It's being used now with a variety of different products. It helps hyperpigmentation as well. Skin firmness. This is a study showing the benefits in skin firmness. Photo damage. This is a very interesting study which showed a reduction in photo damage, both in terms of pigmentation and fine lines from that perspective. So again, anti-aging effect from photo damage with curcumin. So very, very exciting. This is one of the key aspects that I talk about and look at. The final medical food that I'm going to talk about is genistein. Genistein is something fascinating to me. And there are two medical foods. One is Fostium and the other is Fostium Plus. And both of these are actually indicated for osteoporosis. And I'll touch on a lot on osteoporosis, but this really has to do with postmenopausal women. And here's my 55-year-old female going through menopause for years, skin changes, dryness, wrinkles, bruising, hot flashes, significant osteoporosis, and the question is what to do. So osteoporosis, we know, is very, very common. 55% of persons over the age of 50 have osteoporosis. And genistein, especially in combination with, and this is Fostium Plus, vitamins K2, D3, zinc, and phosphate, and calcium, is specifically indicated. And there are multiple mechanisms of action and studies that show the benefit of osteoporosis. And you can see here the one placebo-controlled trial on the right here showing the femoral neck and spine improvement in terms of changes as well as versus placebo over 36 months from there. What's interesting is that the common drugs that are used for osteoporosis, such as biophosphonates, Fosamax, Prolia, Envedity, and Invista, all have significant warnings and side effects. Certainly, we know about the GI ones from the biophosphonates, but there are issues from rashes to osteonecrosis. And then for some of the newer drugs, we're talking about myocardial infarction, thromboembolism, and genistein is something that, as you'll see, does not have any of these side effects. There may be some mild stomach upset, but that's very, very limited. And it's probably in those patients taking a Fostium Plus, which has got calcium and vitamin D, because the placebo has a similar incidence in these trials of stomach upset. So this is just showing the difference in the bone scores of this, and the lower the score here, the better the result from there. And you can see the difference here from the bone scores and the bone histology, the quality. Again, the lower the number, a histologic score, the better it is. You can see here the versus all the other ones, the benefit of genistein. So this is really one of the most effective treatments and very safe for osteoporosis. And this is the femoral strength as well. Now, the idea here is that to me, this is one of the key elements of treating postmenopausal women. And menopause, we know, is triggered by declining reproductive hormones. In the US, it's an average age of 51, or by ovariectomy. Due to loss of estrogen, there is increase in cardiovascular disease, osteoporosis, sexual dysfunction, and from a aesthetic point of view, changes in fat distribution and skin changes, hot flashes, chills, etc. The skin changes include hair loss, thinning of the skin, slower wound healing, and HRT certainly can reverse these changes in symptoms. But in certain studies, estrogen replacement can theoretically increase some risk of heart disease, stroke, and blood clots, and even breast cancer. And genistein, I think, as you'll see, can be a much safer solution for this, especially for the signs and symptoms of menopause and the skin. So genistein is a natural soy or non-soy, and in the Fostium and Fostium Plus, it is a non-soy phytoestrogen. It's a beta phytoestrogen. I'll get that in a minute. And because it's a beta, it is actually anti-cancer, reducing proliferation, reducing hot flashes, and multiple positive effects systemically and on the skin. As I said, this is a beta phytoestrogen, and this is very different than estradiol, which is an alpha and a beta. They have very specific differences. The beta selective agonists improve everything without increasing the risk factors of both breast cancer and other aspects as well. So it's got all the positives and none of the negatives. This is a great paper from you talking about all the benefits across the board here. We're talking about, as I said, osteoporosis, reducing bone resorption, increasing deposition, reducing fasting glucose, insulin, and insulin activity, reduces hot flashes. I'll show you cardioprotective activity, cardio markers, including HDL, increased HDL, decreased LDL, and triglycerides, shown to prevent breast cancer, and even to prevent recurrences, protect against endometrial cancer, PCOS complications. And what's interesting, it reduces the BMI in postmenopausal women, and I'll touch on skin disease as well. So in cardiovascular, this is a great study. It showed that genistein has effects on improving cardiac dysfunction, ischemia, reperfusion of the heart. It decreases toxicity, modulates lipid profile, and even lowers blood pressure. In animal models, it's been shown to have anti-inflammatory, immunomodulatory, and pharmacologically, the effects on cardiac dysfunction, toxicity, etc. Look at this as a remedy. And there was actually a study that was done that looked at post-COVID vaccine cardiomyopathies, and genistein was the only thing that was indicated that had some very positive effects from there. This is a study on hot flashes, showing this very significant, and I have a number of my patients and my staff actually on genistein. They love it. It has really worked for reducing hot flashes, but it does so much more. And I think this is really another of the aspects. The anti-cancer effect has been looked at now in multiple different types of tumors, and it has effects by increasing apoptosis, decreasing proliferation, metastasis, invasion, etc., by multiple pathways from that perspective. There seems to be a role in preventing breast cancer and recurrences by a number of different mechanisms here. And studies are very interesting because you can look epidemiologically in Asia, especially the proportion that have very high soy diets versus lower soy diets. And in Asian women and men who consumed soy diet that was high, there's a 40% lower incidence of breast cancer versus a non-soy diet. And this actually was very interesting because they did a study and looked at when an Asian population moved out of the soy-rich region, moved to the US, for instance, they lost the protection. So it was clear that it was from that aspect. And then a large study, including patients with breast cancer diagnosed, found that the consumption of soy, again, genistein significantly reduced breast cancer recurrence as well. In the skin, it does some amazing things. It increases collagen production, decreases MMPs, which affect the breakdown of collagen as well, increases skin quality, decreases bruising. It actually also has been shown to decrease prostate cancer risk in men. It very significantly affects in a beneficial way wound healing. In fact, I know a lot of my plastic surgery colleagues who put their patients on this a few months before a facelift to improved wound healing and tensile strength. It has significant photo protection, protects against skin cancer, UVB, skin burns, permanent dimer formation. And based on that, also improves the appearance of skin as well. Wrinkles and elasticity improve. This is in younger individuals, and in older postmenopausal individuals, it shows very significant improvement in this population. So, in summary, I'm very excited about this category of medical foods. I think it presents us with a unique opportunity, not just with dermatologic disease, but in overall disease management, but also in health and well-being. The key issue here is these are different than supplements. All of these, diosmin, curcumin, and genistein, you can buy over-the-counter supplements, but they're not the same. And I think that's really the key. You have these benefits across the board for the three that I talked about, but I think the key issue is medical foods. And I'm going to say something here that the next slide that I don't usually talk about here, but I think it's very important to understand how to get these medical foods because I think that's really key. So as I told you, we have these three prescriptions: vascular, rheumate, and Fostium, or Fostium Plus is the fourth. You get these through specialty pharmacies. They are very affordable through specialty pharmacies. The majority of these are less than $50 a month. In South Florida, it's distributed, well, actually in the whole country through Primus Pharmaceuticals. This is the main person, Alyssa Lawson, who is the main representative for Primus in South Florida. So I think the idea here is that these are unique because they're medical foods from that perspective. So I am going to stop there. I thank you for your attention, and I think we have some time for questions, Laura, if people have some. So thank you.
Yes. Thank you so much. This was really informative. Very, very interesting. So, yes, we have some questions from the chat box. If anybody has any more questions, you can put them in there. Um, would you like me to read some of them, Dr.
Please. Yeah,
Nestor?
that'd be great. Yeah.
Okay. So, my husband was on methotrexate for years for psoriatic arthritis, and could not take turmeric. It's just a comment.
So,
So,
so the issue here for methotrexate is really about L-methylfolate, because that's really what is protective for the liver. And again, the idea here is turmeric and this medical food called rheumate are very different because a lot of turmeric is sold either, as a food product or other things and is not tolerated necessarily very well. So again, we're talking about a very different situation with this medical food called rheumate.
can you explain a little bit of the difference between the medical food versus the supplements and
Absolutely.
how they're different?
So I can actually go back to this if you still can see my screen.
Yes.
This is really the key issue here. The idea is that supplements do not really have much oversight. This is one of the biggest, they've done multiple studies that show one supplement is very, very different than the other, even if it's the same ingredient. Some supplements have nothing in there. Some of them have toxic metals, etc. So the idea is that because there's really no safety standard involved, you don't know what you're getting, and you don't even know what you're getting from batch to batch. Because medical foods are FDA quality inspected, As I said, you're getting here pharmaceutical grade, single source, purity, bioavailability, and then the pharmacovigilance of the factories, et cetera, that are making this, I think, are the key aspects that make it different than supplements. And then, the idea here is that they're under prescription by a healthcare provider, and that really makes it different from there as well.
Thank you for going through that again, just in
No,
case people aren't familiar. Um, let's see. So I have a question from somebody who asks about adding to our diets, and is it worthwhile to add turmeric and black pepper to our diet, or should we look for the products that you're mentioning?
so again, I think the issue is that a number of people, certainly look to add this. If you like the taste, if you like all that in your diet, great. As I said, it's very, very safe. The problem is if you're looking at this for therapeutic benefits, specifically for therapeutic reasons, rather than overall, diet benefit, the idea is that these medical foods can really be a very, very substantial bioavailable and reproducible source of benefit from that perspective. That's really what separates it. Certainly doesn't mean you can't put turmeric in in your cooking, etc. There's no downside to that. I'm just saying that it is very different in terms of using it as a therapeutic treatment.
Thank you. So, Patricia Blenay, I believe you have your hand up. Would you
Yeah.
like to?
Yeah, I have a question. It's faster than typing it. So, um, are there any like contraindications with other medications that people might be on or something?
So for what specifically for which one are, I can tell you for overall for these, there's very few
Mm.
contraindications. Okay. I will tell you that despite the studies, if a woman has had breast cancer, okay, I will have them check with their oncologist before going on the Fostium. The data is very clear to me, and the studies are clear. However, there is an increased incidence of recurrence, and I just want to make sure that the oncologist is very, very well aware of all the data for that. Other than that, does not seem to be a lot of contraindication to what we're talking about here.
Thank you. Yeah, I was wondering about like interactions, if there's any like studies on interactions.
So yes, there have been, and the problem with anything with drug interactions is that it's mostly having to do with reports after the fact. And there have been some questions or reports for vasculara. Does it increase bleeding time, etc.? There's no evidence whatsoever it does, but there have been reports about that. There has been one report on curcumin with liver toxicity, but the problem with that, it was based on supplements, and it's not clear what else was in the supplement. And that's what I was talking about. A lot of toxic metals and things like that could be in there. There aren't a lot of other problems associated with that as well.
Thank you.
You're welcome.
So, is there a there's some questions about prescriptions, and so who is there a site where people can find?
Yes.
Yes.
Yeah. So Primus Pharmaceuticals, as I said, is the purveyor, so to speak, of these specific medical foods. I don't get any benefit from saying that. I am a consultant to the company, really scientifically. As I said, Alyssa Lawson is and I showed those information. I can do that, can be contacted. If you want to get samples or any of that, because they have that. This is 954. Sorry, that should be a not a zero, 4394646. And that's the email there. And Primus Pharmaceuticals has a website and it talks about all these as well. There are two specialty pharmacies, Blinks and Integra in South Florida. It's Integra from there as well. Those are the specific aspects from there that you can get information about the specific products. And as I said, the nice thing about this is through the specialty pharmacies, they're very affordable for the patients, whether they have insurance or not. And that's the one thing that Primus has done is they have a low price, whether or not the patient has insurance. So that really makes a difference.
Let me get that again. Is it 954? It's the first three? 'Cause I'm putting it.
954 439
Okay.
4646.
Yeah, I put it in the chat. I'm going to put it for everybody. I accidentally sent it to not everybody. Um, Great. Okay. And then, yeah, there's a question about the base ingredients grown in this country versus China and India. And for medicinal foods or medical food, sorry, is there who checks that standard?
That is a great question. And that really goes to the difference of supplements as well. In this case, it's FDA, it's the FDA. And all the ingredients except, I believe, the genistein, which comes out of Italy. The other are all from the US. They're all very significant, inspected, and regulated by the FDA. So it's very different, as I said, from a lot of the supplements where you don't really know where the ingredients are coming from at all.
Great point. Oh, there's a question from Lorna Bent. Would you like to ask a question if you haven't already? Your hand is up. Maybe it's accidentally.
Can you
Yep.
hear me now?
Yes.
Yes.
Yes. Oh, yeah. I asked a question about whether products were made, grown, whether here or out of the country. But I also want to ask you about the test that's being done. Like when you have these medicines, do you need to have a blood test? I have a friend and her whole family goes to this person who checks their blood and tells them what minerals, you know, they're short of, or if they have a headache, where it could be. And then after that happens, she goes and then she tries to get a medicine that treats that. So she's something similar. And she's been doing this for years. But how would, if a regular person who wasn't really into holistic medicine and didn't read a lot, just a regular person, how would they go about knowing, okay, I'm black, so, or I'm Chinese, so I need to see if I have a place for absorbing this thing and that they won't be doing me bad instead of good. You know what I'm
I
saying?
know
The
exactly what you're
genetic.
saying. So I think the issue here is that the whole field of integrative medicine is really expanding this issue of what is good from one person is not necessarily good for the other.
Absolutely.
And, especially what we talked about with MTHFR and other things, the idea is that for what we're talking about here, there does not seem to be a big issue from that perspective. I think the future that we're going to see in integrated medicine, you're seeing this more and more, is where we're testing the genotypes of individuals to better understand what treatments and even what foods people will benefit from and have problems with in the long run. And I think this is really an advancing field looking at the genetic haplotypes that individuals have. MTHFR is one of the things that have been looked at more and more these days. But I think in the future, We're going to see this across the board. And we're seeing this actually in dermatology. There's a company that does this for atopic dermatitis that said, okay, we're going to test your genes, and because of this, certain medications will be better for you than others in terms of treating your condition. And again, I think this is going to be something as the next few years goes by that we're going to see more and more, whether somebody comes in with hypertension and you check their genes and say, hey, this is a better medication for you. Or, the issue, we already see this with blood lipids, that there are different reasons, and you would treat with one drug versus the other if they have a genetic predisposition versus their diet, etc. So I think this is a real exciting new field that is going to grow by leaps and bounds in the future.
Thank you.
So there's a question about which I kind of thought was interesting. Somebody's taking a Tesla, which I think is, so, and they, yeah, for psoriasis. So how would they go about? So they would just call them
Yeah, they
and
should
find
speak
out.
to the dermatologist, number one, but I have a lot of patients on combination with roommate all the time because there is combination benefit from there.
Right.
And then somebody has their hand up, Lydia. Yes.
Yes. So I asked to unmute Lydia.
Okay.
Oh, there.
Now,
Yes.
hello. Yes. Okay. Sorry. Did I understand correctly that you said this this prescribed legal food is can be prescribed by our insurance? In the health insurance will pay some of
So the
that.
answer is yes, some insurances cover it, but as I said, Primus has done something very few pharmaceutical companies do, and that they've priced this through these specialty pharmacies that's affordable whether somebody has insurance or is covered or not. So I think that really makes a difference. And as I said, almost everything we're talking about under $50 a month for these, which in the age of $100,000 medications, that's an incredible benefit.
Okay. Thank you.
You're welcome. All right. I think probably anything else, Laura, before we close?
Yeah, I'm scrolling through. I do not see anything else. If somebody did have a question that I have missed, I apologize. Raise your hand. But I believe we are finished with the questions. Perfect timing. It's exactly 1 o'clock.
Well, thank you so much for your attention. I really enjoyed this. I hope everyone got a lot out of it. And I will look forward to talking to you guys about something else in the future. Okay?
Got a lot of positive thank yous and very informatives. And just so in case you're not looking, so thank you very much. We are so appreciative for your time.
My pleasure. You have a great day, everyone. Okay? Thanks so much.